We're back. People come to me frequently and they say, the doctor gave me this machine, and they'll hold up a little handheld battery operated device that stimulates their muscles. And I'll say, what does it do? And they'll say, it makes my muscle twitch. Well, we call that muscle stim in some instances, and we call it a TENS unit. TEN is in TENS because it means transcutaneous electric nerve stimulation. And all that simply means is it's giving your brain something to think about while it's stimulating the nerve in your body around most likely your injury site. So people come to me and they have these machines, or they want to get one of these machines, or they saw something like one of these machines on QVC or some advertising program, and they want to know, should I use it? Should I keep using it? Should I go buy one? And here's what I'm going to tell you, and here's what I believe. We use these machines for various reasons, but one of them is almost to use it like a counter-irritant. That would mean that if something is bothering me here, and my brain is focusing on that pain here, I'm going to put pads maybe around it, or even further away from it. And I'm going to turn this machine on, and I'm going to feel these pads with their little electric stimulation around the point of injury or away from the point of injury. And what does that do? It distracts your brain. We call it a counter-irritant. So the brain starts reading the signal that's coming from the pad, which is not around or in your injury site, and hopefully it shuts the door to the pain message that's coming from the injury site. Simple, right? Boy, if that worked, we'd all have one of these machines and we'd all just use it all the time. What's the problem? Brain's pretty smart. That's the problem. And the brain goes, oh, I know what you're doing. You're trying to distract me again. So, here's the answer. If you have one of these machines, if you want one of these machines, yes and no. It may be helpful, it may be useful, it may be useful for a short period of time, but eventually, more likely than not, the brain's going to figure out what's going on, and it's going to say, oh, I know what you're trying to do. And you may, as an extension of that, use counter-irritant creams. So you're using that machine, and then you're using a counter-irritant cream or a counter-irritant patch. But in either case, in any case, what you're trying to do is give your brain an input that is other than the input it's receiving from the actual injury site. So I hope that helps you, and later we'll talk about bracing and how that's helpful to you. If you have any further questions, give us a call at the office. We'd be happy to talk to you. Bye-bye.